Hello and welcome to another edition of Health Solutions with Shawn and Janet Needham, where Team Needham discusses everything healthcare. I'm your host, Shawn Needham, and I am super excited, and of course, my wife, Janet, and I am super excited to be streaming from the Moses Lake Professional Pharmacy podcast studio, and I am really excited to have Charles Frohman back on our podcast. He is a fellow health freedom advocate like ourselves, and he is going to tell us how you can free yourself in the health benefit market and just be free in general. Because if you are following this right now, you're following health insurance right now. I had some friends that work in traditional pharmacies that bill insurance, and 85% of all the insurance billing systems for pharmacy are down nationwide. One of my friends also texted me a picture Saturday how Safeway Pharmacy cannot bill any insurance, and it's a global wide issue. And if that is not another reason to not let traditional health insurance control your life, I don't know what is. So with that, Charles is going to talk about some of the ways to free ourselves from that system. Charles, welcome to our show.
Thanks, Shawn and Janet. Good to be back with you.
Yes. So tell us a little bit about your history, and then I want you to kind of comment. I don't know if you knew about the pharmacy billing, health insurance billing thing being down, but you can comment on that. Because when I think about somebody that says it's nationwide or Safeway Pharmacy posts globally, that's scary. Anyway, introduce yourself first, Charles.
Sure. Forbes magazine featured how our brokerage protects people from unexpected catastrophic health expenses using not insurance, but something we think is better, medical cost sharing. And that is what I sell people, families, and businesses now, especially with this thing called ICRA, Individual Coverage Health Reimbursement Arrangement, with which we can bring sharing into big companies. And that's a game changer because when you give any kind of structure a monopoly, like insurance has with payment, bad things happen, like what you're discussing with reimbursement issues, or even before that, with the fact that no matter how much you're paying for Obamacare, you have a network, which means if you get cancer or heart disease, you can't go to the state of the art hospitals for cancer or see the best surgeons who don't need sickness reimbursement to make their money. So they're not going to be in network. And if you're hospitalized, you may get an anesthesiologist or some specialist who's not in network, thus exposing you to bankruptcy from a surprise bill. I have a lot of sophisticated clients who know that there's no reason to overspend on insurance when it's not even as good as sharing in the first place. So that's my response to your comment about insurance. Is that it's a ripoff, and just abandon it.
Yeah, it totally is. I say it over and over again. Traditional health insurance is a ripoff and a scam. It's one of the most overpriced things around. Things aren't covered. And you mentioned, people always say that, oh, it's so important to have health insurance because, I don't want some kind of catastrophe to bankrupt me. Well, you can probably hit on this a little better than I can, but over 50% of all the people that file bankruptcy on healthcare bills, over for 50% of them are already insured. Can you speak to that?
Yeah, that's because the average deductible on any exchange plan you might get through Obamacare has an amount of $6,000. That's the average. And, when you add up the co-insurance, that's 20% you owe for the hospitalization, the surgery, your max out of pocket could rise to 15 grand or more in some cases. Or if the doctor or hospital are out of network, there's no max out of pocket. So you owe it, and they're going to collect, and you're going to declare bankruptcy to avoid that collection and ruin your credit and your future and your life. So that kind of trap is something too few are aware, and there are a lot of victims because of Obamacare. Now, we use it as a backstop, but even before Obamacare, most states offered risk pools for the uninsurable, and you had Medicaid for the poor. So it was a lie to start with why they passed Obamacare. You didn't need guaranteed issue. All that did was force insurers to limit the doctors they would use. That brought on networks. So you squeeze the balloon one area, you're going to get something worse, an unintended consequence somewhere else. Luckily, sharing is allowed to exist in most states, except a couple where state insurance commissioner, on behalf of their controlling insurance companies, will make life pretty hard for the sharing competitors and issue cease and desist orders. Or that kind of thing. But basically, in almost every state, you can get some sharing plan, save money, get access to any doctor you want. Ours will even let you go to doctors overseas and any kind of natural doctor too if you're cancer. I don't know about you, but if I got cancer, I'm not going to an oncologist. I'm going to Tijuana, where Gideon Krause has the Gerson clinic with these what do you call them? The chambers you go into for
Hyperbaric chambers.
hyperbaric juicing, fasting, probably some homeopathy, mistletoe injections, all kinds of great things that actually work to help your body start working again. So the point is, there's alternatives to Obamacare where you won't get bankrupted, you won't be limited who you can go to. You'll save a lot of money. You can go to anywhere you want worldwide, even natural stuff, and you can combine it with a health savings account so you can pack up a nest egg for retirement. And you could use that for long-term care, Medicare gaps, or a new boat. It's your money. So,
Janet, I can tell you're just you. There's a lot going on right there, and I can tell you just really want to ask some questions. So, what are they?
Well, I guess I gotta go to the out of country thing, because most people assume that everybody comes to the United States for their health care. So I think that's really interesting that you're offering that service, because we do know people personally that have went out of country for their cancer treatment and have done very well. So I'm just curious about that, how that happened, because that's not something we hear of very often.
Well, it's just an option advertised when people enroll with us that two things. If the bill is in English and US dollars, it'll be shared with the community. So it's as simple as that. And I know people who are concierge for getting surgery overseas, particularly in Brazil. There's a lot of what do you call those stomach surgeries that a lot of folks want to go get?
Bariatric.
Abdominoplasty or bariatric surgery?
Apparently it's a huge market in Brazil.
Okay.
My aunts in Austin, Texas, go to Merida, Yucatan, for teeth work. Apparently that's a big destination for expensive dentistry. So, medical tourism is an offering that a lot of at least sophisticated people know about, if not the general population. And if they're trying to save money or get alternative care, which is going to be increasingly something folks want to do, they eventually will learn about medical tourism. There's all kinds of articles about care in India and Thailand. Even these socialist medicine countries have cash markets for medical tourism now. Canada is a big destination. Rand Paul went there for surgery. So there's even cash markets in Canada, which otherwise sends normal people to the hospitals along the Great Lakes for high-class surgery. So, Janet, yeah, you're right. Our hospitals are destinations for foreigners to get decent care when they're rationed by the socialist system.
But there's something very unique about this, because this is really saying you're listening to your consumer and asking them what they want, and that becomes a part of the package because they get a voice in this. Where I'm sure if you're overseas and you get hurt, your local typical insurance is going to say, out of country, no thanks.
Yeah, there's so many limits, and not only that, there's controversial stories about insurance companies using AI to arbitrarily deny claims, making you go through hoops to get your bills paid. When you get on the phone with our concierge, with sharing, if you have an emergency, dial 911 or go to the ER, take care of yourself. Call our concierge, a simple 800 number, as soon as you can, so that we can coach you on being a cash patient. starting with identifying yourself with the doctor or hospital as a cash patient and asking for a discount. That's all you have to say. It's no one's business that you're a member of a sharing community. But
Right.
we're going to go ahead.
No,
No, I
exactly.
agree.
And
I agree.
yeah, go
Yeah.
ahead, Charles, because we got a story, personal story. Go ahead.
Yeah. And then seek the concierge advice on options. My cousin died of cancer using Sedera, a popular sharing company.
Mhm.
Sedera and Zion are the two big ones that we licensed health insurance agents use pretty much exclusively. And slowly others will enter into the market as it grows. Right now, those are the two leaders. So our brokerage switches you back and forth between them and package it with a concierge, HSAs, free counseling, et cetera, all kinds of bells and whistles. But we're going to guide you on how to get your bills paid, how to choose treatments, and hold your hand, which is really important because
Mhm.
the biggest hangup we have is not that we don't have a great solution. Forbes featured it. It is the best solution in the country, no question. Most folks aren't used to it. They're used to slapping the Blue Cross card on the counter and asking, "What's my copay?" That's why we're in this mess.
Right. And one of the problems with that is once you throw that Blue Cross card on the counter or United Healthcare or whatever insurance that is, you as a consumer gave away all your bargaining power. You have none now. You have no bargaining over prices, over what's covered, over what's billed. You've given all your rights away. So that's another reason I don't like traditional health insurance. Now, I want to tell you a personal story about us. So, first of all, you talked about some states that don't allow health sharing. I don't know about those states personally. I do know this. Washington State, where we live in, a very communist state, run by a tyrannical governor and attorney general, they outlawed Sedera and Zion because they're not faith-based. You probably know some of these stories. Fortunately, we can still access faith-based ones like Samaritan Ministries and Christian Healthcare. Jan and I personally have Christian Healthcare. Listen to this, Charles. I don't know if you know this, but I want you to share this with your members about what a ripoff hospitals are that bill insurance and how they try to screw the consumer. One of the mistakes we made, and I think you've already touched on this, that's why you're telling your patient, your clients to say you're a cash patient.
Mm-hmm.
Don't say that you have health sharing ministry at all. Don't say you have a health sharing plan. So we made the mistake in Washington State when my son broke his leg, middle of COVID 2020, compound fracture, needed surgery. We made the mistake of saying we had Christian healthcare. And the problem with that in Washington State, the hospital lobby, I'm sure, follow the money, lobbied the senators and the legislator to make a law that if you have a health sharing ministry, the hospital cannot give you a discount legally. That is so corrupt. It makes you really, really realize how corrupt hospitals are. Now, a little backstory to that. The reason that is as you know, in states, because what was happening, I've got a story of a doctor that in Arizona that practices. His patient had a heart attack, had a health sharing ministry. It was a $300,000 bill. They told him, they said, "Hey, we got a health sharing ministry. What kind of discount can you give me?" Next thing you know, they wrote off $250,000. So the bill was only $50,000. You know as well as I do, Charles, the bill should have been $50,000 in the first place. They didn't write off no $250,000. These nonprofit hospitals, I should say tax exempt hospitals, get to write that part off so they don't make profit on it, but it's a total scam. So we were able to beg, plead, borrow, steal, twist arms enough for the CFO to get a discount from the hospital. And of course, they said they were doing us a favor. Thank you so much, hospital. You are so benevolent. Thank you so much. I love your charity. You can see my cynicism. Anyway, next time, anytime we have any kind of healthcare experience and we have to have some kind of coverage, we will tell them we are cash pay, and how we get reimbursed is none of their business whatsoever. And it shouldn't be. Just like if you go in and you buy a car and you tell them you want to buy a car, if you have the money, they should not matter at all how you are paying.
Or what your insurance
or
is.
what your insurance is. You go.
Exactly. And so in the almost decade that we've been in operation, our concierge has beefed up with lots of staff and lots of experience on how to coach a cash patient. And that is one of the things that we've had to learn over the years, is that it's no one's business that you happen to be a member of a sharing community, because the hospitals will use anything to not give you the cash price. But you know what? They all have a cash price, and so within a couple of months of getting the super bill, we will have negotiated with the hospital to get a cash price that they agreed to, and then you would pay with the money we ship you, the $100,000 bill, minus the $1,000 that you owe. Keep that in
Right.
mind, folks. Obamacare puts you under for $6,000 on deductibles, $15,000 max out of pocket. Sharing, you can have out of pocket limits as low as $1,000. So that's all you'll pay. But always ask for the cash price, and we tell you to get on the phone with the concierge ASAP, so that we can hold your hand, because you're not going to negotiate prices without our help. Some folks can, most folks
Right.
can't.
It is a real nightmare. I mean, I was able to do it, but I'm in this industry. So, and I've been a commissioner at a hospital board. Obviously I've been around the industry, so I know the ins and outs. So I was able to negotiate prices and look at what Medicare allowables are and compare all those things. But most people can't, because they make it complicated for a reason. They don't want people to figure it out. That's literally the case. And their argument always is, well, healthcare is complicated. Here's my comeback. Look, if you can't give me a transparent price, you're hiding something, because a brand new car is a complicated piece of machinery. But if you ask the car dealer how much the car is, they know exactly, just like that. And if you want to do some kind of certain add to it, gold wheels, they'll know how much gold wheels are. Then it's all transparent, no surprises, right?
Yeah, and our concierge will use tools just like that. The main one being Healthcare Blue Book. They have a red, green, yellow light system on all the doctors and hospitals, especially if you have a surgical recommendation that's discretionary. If you use our concierge and our tools to help you find a well-priced, high-quality provider for that service, we'll pay the provider directly, saving you the hassle of collecting the money in the bills, which can be a real burden if you're hospitalized. You get lots of different bills, timed differently. So we'll incent you to work with our concierge and our tools to get you a well-priced, high-quality physician or hospital. We'll use other tools like Prater, Savos out of Utah. These bundlers. That's the whole game for transparency, is to get good bundle pricing in advance. And then the next big nut to crack, of course, is quality, which is really hard and subjective. But that comes through like any other market: word of mouth, reputation, that kind of thing. But back to your friend, it's Mr. Kreidler, the state insurance commissioner in Washington, who is the
Oh,
puppet of the
yep.
insurers, who makes life heck for the Sedaras and Zions of the world. And all you can do is be a better citizen and replace these puppets with statesmen or stateswomen who will actually respect the Constitution and American values, which your state does not have, unfortunately, at this point.
Yeah,
So
I agree. So tell us a little bit. I can speak for ourselves. If we were buying traditional insurance, it would cost us, just Janet and I. We don't have any kids at home anymore. Uh, um, it would be like $2,000 a month, so $24,000 a year. Right now, with Christian Healthcare, we pay $180 a month. Now we choose to have the highest deductible, even though it's not a deductible, as possible. And we choose to not have a lot of coverage because we just don't need it. Like, for instance, prescription coverage. I think prescription medication coverage is the biggest ripoff ever. Of course, I'm a pharmacist, so is my wife, and we don't believe in medications to treat long-term disease. So prescription coverage would be a waste for us. We don't have any dental coverage. I think, again, find a good dentist that you can get cash coverage for. Now, a lot of dentists have been hijacked by insurance, so that's why dentistry has gotten expensive, and they have tourism dentistry out of country now because our dentists in this country have been hijacked by insurance, like medicine has. But you can find a good cash dentist. Eyes, glasses, biggest ripoff ever. If you need glasses, pay a couple $100 a year, and instead of a couple $100 a month. You don't need all that stuff. So we choose to have the bronze plan of Christian Healthcare, and it's $180 a month. We save $20-some thousand a year on insurance, and we get to decide what doctors we go to, what is covered. We get to negotiate cash prices. If they don't know a price and it's an elective thing and it's elective procedure, surgery, we walk out. If they can't give me a price, what else they hide? I mean, seriously. So tell us a little bit about your program, Charles, and how you, what the cost comparison would be.
So what's your initial insurable amount? Is it 10 grand or something else?
It's 5,000.
Five grand. And you're paying 195?
180.
180. So we're more expensive. We partner with Zion mainly, but we add free counseling, free concierge shopping, a QR coded medical vault for your records, and Sirius MD for our virtual DPC telemedicine. So we added bells and whistles, so it's going to be more expensive. So for 5 grand, I think we're charging, you're over 50, 235 a month.
That's still very affordable. And one of the things is, Charles, is, we would tell people to join a DPC, so they can have 24/7 access to a doctor. Janet and I don't join one because we have lots of friends in the industry. So if we have access anyway, we don't take advantage of that. But definitely, if I was a consumer of healthcare, traditionally, that's what I would do, is have a health sharing ministry and a DPC. So your guys that's very cheap. Basically, for an extra $40 a month, $55 a month, we could have access to a DPC through your plan.
Well, the DPC is extra, of course.
Oh, okay. I thought that was covered. Either way, very, very inexpensive.
No.
And tell me about the HSA and HMA, because there's a difference or something. Educate us.
Yeah. So, a lot of folks don't want a religious plan. So that's one reason they're willing to pay a little more for a secular plan like ours. And then a lot of folks want an HSA, which you can't get through your plan. Right. Unfortunately, it doesn't have the proper MEC, which we embed, that has a structured deductible allowing for the HSA. And that's a little bit more expensive than what I showed you. I showed you our cheapie plan. It's $295 a month if you want to have an HSA. And that's because it's both compliant in those states that require compliance because of the MEC, the minimal essential coverage, and it allows for the HSA. Still, I think you would agree, under $300 a month is still good.
Very good.
Totally.
Yeah. So the HSA is what you would use for overseas. The HMA that doubles over 3 years is what you would use for dental. And for occupational therapy, physical therapy, chronic diseases, urgent care, prescriptions, tests, labs. And I think we've discussed that before. It's like a supplemental policy in cash. So say you want 5 grand, your IUA is $5K for Christian ministries. Pay another $84 a month over 3 years. That doubles to $5K. Now you have a $5,000 prepaid Visa with which you can use for your dental, your any out of pocket, even chiropractor. So that's the best thing to couple with a plan like yours, and then because you can't get an HSA, I would do that. So folks can contact me. It's fantastic, to have a cash account for all out of pocket versus a dental plan, which is a ripoff, just like visual. With dental insurance, you're paying a set amount for a limited number of benefits. Why not just get a cash account for all out of pocket?
Right.
So it's domestic only. So you would use your HSA for out of country.
I see. Okay, that helps. We have a comment. Is that true, Julie? Can you stream that comment or a question? Oh, good information. Well, thank you, Maria. Such good information. Thank you for sharing. Thank you for watching and commenting, Maria. We appreciate it. Our goal of Health Solutions is to educate and empower individuals to take charge of their own health. And one of those steps is financially. We believe that people should take financial responsibility of their own health. And one of the reasons that healthcare has gotten so expensive is because people haven't really been making their own payments. They've been relying on somebody else. So one of the things I like about health sharing is, just like when Jan and we were responsible for the bill. When our son got hurt, we were responsible for the bill. Christian Healthcare sent us a check, but we had to pay the hospital. That also meant that, we were trying to do whatever we could to negotiate a payment and a price so we didn't have to pay as much. And in our health share, they just changed this, but anything we negotiated down, we got taken against our deductible. So we negotiated a $9,000 discount. So we ended up paying zero because it was way below the $5,000, was way below the discount that we had. Now, they have since changed that policy. Either way, it's still a much, much better way to seek healthcare.
Yeah, no question. I mean, all the sharing options are good. We like ours just because it gives you the HSA, with which you can build $100,000 for retirement.
Well,
So
it
it's a
also
nice thing
gives
to
you
have.
the chance to plan. I think that's what I'm hearing in this, and I think that about being financially responsible is you have to have a plan and goal in place, so you're not overwhelmed when something does happen. So you're not just walking into it blind. You have something to fall back on, and then you also have resources, like you said, to help people go through that, because most of us in this country are not like Shawn and I or somebody that works in the industry. Even in the industry, it can be difficult, but there's people there that are able to walk you through. And then if you've planned something, it's not quite as scary. It's not so overwhelming. And those decisions are better because you're just not reacting.
Yeah. I think whatever sharing option you choose, make it because you're going to save money from Obamacare. You're going to gain access because there's no networks. And when you save money, you have more money for other things that are important in your life so that you can plan. Now everyone is paying out the nose through Obamacare unless you have a taxpayer premium subsidy. And then you're going to have a bankrupting bill when your doctor is out of network.
Well, and that's one of the things that people don't realize. They don't do enough research. They have an employer that pays for their health insurance. So they wash their hands of their responsibility completely. And they do no research whatsoever. And they think that they're just, whatever happens, I'm covered. Then all of a sudden they have a knee surgery and it ends up being, $60,000, and their out of pocket is $8,000 or $9,000, and they realize they could have just paid cash, not waited for pre-authorization, and just flow down to Oklahoma Surgery Center and had surgery for $8,000, literally. And they would have saved money by doing that. So if they had a medical savings account like you're talking about, that they would have been way ahead.
Yeah, or we list bill small employers, 49 people or below. So the boss is paying everyone's bill on a list, but every sharing plan is owned by the employee, so that when they lose or leave their job, they take it with them. It's portable. So a sharing plan in a business is not a group plan. It's a collection of individual plans. So it fixes these plans fix the mark in so many ways by generating cash shopping. You got to have prices for a supply and demand curve, and it portabilizes the group benefits. So we can end that edifice because I don't like employer benefits. And then if they had my list bill with an HSA with a $1,000, IUA out of pocket limit, they're protected. They go wherever they want. They're only paying $1,000. They're building an HSA nest egg, which they're going to need for long-term care. I mean, no one has long-term care insurance. And if they can figure out how to divest their assets, maybe Medicaid will help with the long-term care nursing home. Otherwise,
but do you want to want to rely on Medicaid? Do you want to rely on the government for
that's
these
the point.
services?
Is that
Right,
people are in
exactly.
trouble.
I know that's what's your point, but that's why I wanted to bring it up.
The baby boomers are in trouble because they don't have insurance for long-term care.
Well, if you're in Washington State, they automatically take money out of your check for long-term care, whether you want it or not. Because I'll be really honest with you, Charles. After what happened during COVID, Jan and I put in our advanced directives: use our money to take care of us at home. Do not put us in the assisted living facility. Do not put us in a long-term care facility. I am never going to go into one of those places because of what happened during COVID. I want to be taken care of at home. So.
That gets to one of our benefits, the QR coded medical vault. You can put advanced directives there in a living will to say that, also to decline hospital blood donations, and to insist on pre-planned donations of your own blood or someone who is unvaccinated, because that's a new controversy. The Red Cross,
yeah.
But that's and you get the people like the Shawn Needhams, the hospitals, to email us your record. It gets put in our medical vault on our key fob or medical card, and we control our records. And it also lists contraindications. So if we're unconscious and found by an ER provider, that they won't hurt us by using a treatment that's contraindicated. But that's a
Right.
big deal too, controlling your medical information.
Absolutely. And that's what I like about your whole concept. And that's one thing I like about health sharing in general and what you're doing is with health sharing, Sedera is way different than Zion. Zion is different than Christian healthcare. Christian healthcare is different than Liberty. There's so many of them out there. You get to pick and choose, and if you don't like them, you go to another one. And the reality of it is, people don't realize this, but when you pick traditional insurance, United, Premier Blue Cross, Cigna, whatever, I'm missing them, the Bucas, whatever they call those, they're all the same. And here's why: because they are literally, and I write about this in my book, they are literally government insurance. When you pick those traditional plans, they are government insurance. Why do I say that? You've mentioned it a bunch of times on air today. Obamacare. Obamacare, the federal government regulates them so hard on what to pay for and what price to pay for. The government is telling them exactly what to do. So if you have some private insurance that you think is non-government insurance, if it's one of those traditional insurance, it is government health care. You go, Charles.
Not only regulations, but privileges, including the tar baby one. Don't throw me in the briar patch, the MLR, the minimum loss ratio, where you dart insurance companies, you have to pay out 90% of your profits in the form of medical benefits. Well, that well-intended government rule just created an unintended consequence where BUCA, the acronym for these insurance companies, colludes with the hospitals to jack up and complicate bills because there's no incentive to disclose bundled transparent pricing because it's bad for shareholders.
And then writing off that extra money is just like nothing because it's not really a write-off. I mean, they just overcharge in the first place. It's such a scam. And you said it. Insurance companies collude with these hospitals to create what? A cartel. They literally create a cartel to control the market and rip off consumers, period. And it's pure evil. Fortunately, as individuals, there is a parallel system like health shares where we don't have to play their game.
Yeah. And, my big thing, and for coming on here, was that once I've empowered patients to be a cash shopper with an affordable way to do it, which will help the doctors get more cash patients, which they need to leave employment in the hospital systems where they're trapped and helpless. I want these empowered patients and independent healers, freed healers, to join the real movement of health freedom. And that's where I, get paid as a lobbyist for the world's oldest health freedom organization, National Health Federation, to insist on informed consent, to rein in FDA, which on behalf of pharma, their overlords, attacks natural alternatives, like in your industry, the compounders, who no longer can mix natural ingredients like coenzyme Q10, ginkgo biloba, ginger root, or colloidal silver into concoctions, which I think is the future of medicine. We want to personalize your treatments based on your nutrient deficiencies that are found through all these new AI functional assessments. It's you pharmacists who need to seize your ancient compounding rights because we don't want the fillers of these mass-produced pills, even in nutritional supplements. We want personalized concoctions, but you can't do that because of the FDA guidance on homeopathy and compounding.
And
They
like
want
you say, totally by design. I mean, big pharma pays them to do those things. And, not only are you saying it's the future, here's what I say about those things, and not just my profession of compounding, because I believe compounding is the past, present, and future of pharmacy. It's something pharmacists have done for millennial, all right, since the beginning of time. And largely in the 1950s, we gave up that to big pharma. And then most pharmacists are just basically copay collectors and dispensers of poisons for big pharma. That's all they are, really. And when you look at ginkgo biloba, you look at coenzyme Q10, that you say that that's the future, but it's a past too. Almost all drugs came from a plant source, and big pharma knows that. So they try to keep us from from using those plant sources. From red yeast rice, they tried to outlaw that years ago. NAC was on the list for a while. Melatonin was on the list for a while. Lots of stuff that big pharmas want us to use because they don't want us to put them out of business.
Or even doing a batch of compounding with homeopathy to stack it in the office. That's even limited now. Or interstate shipments.
Oh yeah.
We have to introduce bills to restore your rights to supply what patients and doctors want. Or other issues. We want to replace licensing with certification, so that if you're following the criteria of a duly registered certifying organization, you don't need licensing. And that's what's going to expand supply and help the integrated market that we all want, whether it's biocompatible dentistry or natural compounding pharmacists, which is what I want. That we've discussed that before. That's what we need. From the COVID awakening, now is a time for folks to join the health freedom movement, to get a decent plan that empowers you as a cash shopper, for the doctors of all types to assert your independence, to get involved with this movement. We have informed consent efforts, not just with pharma products like vaccines, but also with the coming wireless mesh. That's a new issue folks don't know about, that I'm leading the lobbying on as we speak, educating members of Congress on. It regards the antennas they want to put on these small cells outside their bedroom windows, outside their kids' classrooms, your nearby city parks, around the farms, the national parks. I have a neighbor on Capitol Hill who prescribes visits to national parks to escape digitalization. You can't get relief from the stress caused by this wireless mesh for the Internet of Things and smart meters if the parks are full of antennas too, especially when there's a safe alternative called fiber to the premises or cable. But what about the geoengineering? People see that in the skies and are supposed to just believe that it's just natural from the planes. No, it's not. And with the COVID corruption, we now can discuss these controversial issues because people are ready. They're ready to learn the truth, assert their independence, and take back a republic, which Benjamin Franklin said we'd lose if we didn't keep it. Well, folks, you can't sit back and expect to keep our republic.
That's right. All right, Charles, we wrap this podcast up. I think you already discussed kind of what your passion is. Your passion is just about liberty in general for individuals, and you're helping people seek that through healthcare. So tell us, if anybody has any questions, what's the best way to get a hold of you?
Well, we have a monthly Zoom at National Health Federation, noon Eastern, the third Friday, where I platform the leaders in all these health freedom movements, including with the certification and HSAs and innovative healers. I like to platform people like you occasionally too, but it's more about what we're lobbying in Congress. And then as far as the health benefits, to upgrade yourself and your business, I have different websites for both of those that we can put in show notes. But a simple email just to reach me is healthempowermentforyou@gmail.com. Healthempowerment4u@gmail.com. And I'll hook you up with a decent health plan and HSA and teach you how to get involved with health freedom advocacy.
I love it, Charles. Thank you so much for your knowledge and wisdom. Hang on to the show afterwards because I want to chat with you off air. So thank you, Charles, for being on. You really helped us realize our goal, which is to educate and empower consumers to take charge of their own health. And thank you, listeners and viewers, for tuning into Health Solutions with Shawn and Janet Needham. Tune in Thursday to our midweek podcast. It's going to be actually at 3 to 4 p.m. We are going to have Tara on. She is a nutritionist, and she is going to be talking about how nutrition can liberate yourself from the traditional healthcare. So you don't want to miss out on that. Health Solutions with Shawn and Janet Needham. Thank you for tuning in.